The barbell squat is probably one of the scariest exercises for someone dealing with chronic low back pain to attempt. Maybe you have a herniated disc, bulging disc, you've just been living with chronic back pain for years and years. You're trying to get to the bottom of it and you want to train your lower body, but the squats just feel very intimidating, or every time you do them, they cause pain. Today's video is gonna cover 3 barbell squat alternatives that are great for building strength, size, and endurance in the lower body while protecting your low back. If you've been living with chronic low back pain, you need to stop doing barbell squats. Now, I'm talking to people who have herniated discs, bulging discs, ruptured discs, maybe even severe degeneration going on in their spine. They're trying to navigate their chronic low back pain, but everything they do seems to be making it worse. If you're in the gym doing barbell squats, please stop. And today's video is gonna actually give you 3 barbell squat alternatives that are safe for chronic low back pain, whether it's a herniated disc or bulging disc. Despite your low back history, 1, if not all 3 of these barbell squat alternatives should fit you just fine. Now, if you're new here, my name is William and I teach chronic low back pain sufferers just like you how to overcome years of chronic low back pain by mastering their mindset, improving their movements, and building smarter strengths. If you feel like you've tried everything, you've gone the medical model route, you don't want to have surgery or repeat surgery, and you want to take control of your healing process, this is exactly what I teach here on this channel. Really quick, if you want to take the exercises that you're learning here and apply them to really a fully functioning workout that is safe for chronic low back pain, go grab my free guide. It's my pain-free training blueprint. You can go to fitnessforbackpain.com/pain-free training. I break down really the structure of your workout, the core training exercises, the actual exercises you pick, along with how to apply the exercises that I'm teaching you today in that specific back-friendly workout. It really is the blueprint to training pain-free, if that is your ultimate goal. Just go to fitnessforbackpain.com/pain-free training, grab that free guide, and let's jump back in. The first barbell squat alternative is called the belt squat. Now, there's a few different variations of this. Your gym may or may not have this. If you are an avid exerciser, maybe you have a home gym, I would suggest you invest in this machine. It's really, really good. I don't have one in my own personal home studio, but the gym that I'm a member of actually has one, and I love to use this on lower body days. Essentially, what you're doing is you're taking all the load off of the upper body, so basically from the hips up. You're not loading your spine, you're not putting anything on your shoulders, you're holding it in your hands. You're actually able to load the pelvis and the lower body only with this belt squat machine. And essentially what you're doing is you're adjusting the machine to get set for you, and you have this really big lifting belt that you can wrap around and go as low as you need around the hips to maintain control of the belt so it doesn't fall down, obviously, but also not put a lot of pressure on the low back. From there, you can adjust the weight that you have on the machine, and you're able to control yourself while unloading and loading this weight, and you keep your low back really out of the question when it comes to compression forces. So some people who have chronic low back pain have a lot of symptoms or pain or irritation with compressing the spine. So hard bracing or loading the spine with weight through barbells or dumbbells is problematic for you. And in this case here, I believe that the belt squat machine is a great alternative to pushing the limits on your lower body training without compromising your low back. The second barbell squat alternative is the wall squat. Now I'm gonna jump into my studio and actually break this exercise down. It's a really simple exercise that you can do with minimal tools. So a great squat alternative is using a stability ball. So we can do this with a foam roller if you have one. If you don't have a stability ball or a Bosu ball, you can use this for the wall squat, or you can do a foam roller if you don't have things like handles in your way. Essentially what you're gonna do is we're gonna grab our weight, and you can really push the limits on the weight with this. The hardest part of this is just getting the ball in place, but once it's there, you're good to go and you can kind of memorize where it should be. But you have some wiggle room to make some adjustments to keep it nice and safe. I like to have my feet a little bit wider than shoulder width apart and out from me. So I'm not standing straight up and down. I wanna have some room where I can lean back into this wall and into this ball as I'm squatting. So from here, all I'm gonna do, I'm gonna have my weight hanging down. I'm gonna come just to the point around parallel. You can go a little bit deeper if you want. What you wanna make sure is if the ball is set too high on your back, as you come down, your back's gonna go under that ball, and then you're gonna drop back. We don't want that. We wanna try to stay as neutral, especially if you're dealing with a lot of sensitivity, but you're trying to get out there and work out without hurting your back. Keeping yourself nice and neutral, come back. Cool thing is, if you do get to a point where you go to failure or close to it, you can always drop the weight and come back up. It's really hard to mess this exercise up. You can play around with bracing. If bracing too hard causes sensitivity, dial back your brace. If you're doing it and it causes some sensitivity at a certain point of the exercise, just dial back the range of motion and find a way that works best for you. Now, the third barbell squat alternative is the goblet squat. Now, before I jump into this video demonstrating this and breaking this down, how to do it safely for your low back, there's really two different variations that I want you to play with, and I mentioned this in the demo video. You can do a front squat, which is more of like a barbell type of squat, or you can do a goblet squat. Either one of those, they have their own challenges. There's some technique involved with both of these things. I'm gonna demonstrate the goblet squat, but if you're a little bit more advanced, you don't have as bad of compression type of issues, then you might be able to transition or graduate or incorporate a front squat as well. But before you jump ahead, let's jump in and show you exactly how I coach the goblet squat. Now, I'm gonna categorize the goblet squats along with front squats. Front squats are a little bit more technique driven, so you wanna be careful with trying to do front squats when it comes to like barbells and things like that. You really need to like kind of break it down and make sure that you can do it well before you start loading a bunch of weight. But front squats could be used if you don't like the goblet squat, or maybe you're a little bit more advanced in the goblet squat. You're trying to add more weight to your front squat or your kind of goblet position. The front squat might be a better option. So this is how you do just the goblet squat. Very simple exercise. I personally like to have my heels elevated every time. What I use are some rubber 10-pound plates. You can use whatever you want. As long as your heel has a little bit of a lift to it, you're good to go. You're gonna grab your weight, hold it in this position here. I personally like to have it as close to my body as possible. As you take this weight further away from you, it causes more demand on the back and the posterior chain, which could cause irritation. So keep that weight nice and close to you. I'm gonna show you a front view. Find a position that feels good to you. You don't have to be super technical with how tight or how wide your feet are. Play around with whatever works best for you. Have here, what I like to do is I take my shoulder blades and push them down and then forward. So I'm engaging my lat, and then I'm almost like I'm protracting my shoulders forward. So what this is doing is it's engaging my lats and engaging my whole posterior, upper posterior chain to add some stability. So I'm here, I'm engaging everything. I'm going to slowly come down and come back up. I feel comfortable with a depth where I'm all the way down here. I'm not losing a lot of my low back. If your butt was scooping under for some reason, be mindful of that. I'll show you the side shot of this. Here, I'm lats engaged, protracting, really engaging my upper posterior chain. Breath in. And I'm back up. Again, you may not be able to go as low or as deep as me without having some kind of symptom. So it's okay to either go lighter, go heavier, brace harder, brace lighter, or go a lot shallower in your depth versus going deep. Find the variation that works best for you for these goblet squats. They're a great squat alternative. Remember, when it comes to building strength and using exercise to get out of pain, you have to keep things very, very simple. Oftentimes we try to jump into workouts that are very complex. They're always changing, doing different types of variations of different types of exercises. And what I've found to work the best is finding one really good exercise and getting really good at that to lower the threat in the body and learn to trust your body and the ability to actually put stress on it, such as adding weight or holding weight or doing something dynamic with a load inside the gym. Oftentimes this creates a lot of fear, a lot of tension and protection, which creates a pain cycle. Now, if you go through these exercises and you're like, man, I'm modifying these things, I'm changing these things, and I'm still having pain during the actual workout, or maybe you're having pain 24 hours later, 2 days later, right? What you may be dealing with is an oversensitive pain system. And this is something that you have to dial back the exercise with and take an entirely different approach to your chronic low back pain. In most cases, if you feel stuck, you feel like you've gone through the medical model, you've seen doctors, you've had a surgery, you've had a fusion, you've had injections, you're doing all the things that your doctor or your trusted professional tells you to do, and you are still living with chronic back pain despite the exercise modifications you make, you may just need a different approach. And this is exactly what I do with my hybrid relief method, which is inside of my strength and pain relief accelerator program. This is my one-on-one coaching program that I offer to very select individuals who apply and are a really good fit for it. Now, I can't tell whether you're a good fit or not. The best way to do that is to jump on a live call. It's a strategy call that I offer for free. You can go to fitnessforbackpain.com/apply. That'll give you a a chance to pick a time for you and I to have a conversation and to see if you are a good fit and want to enroll into the Accelerator Strength and Pain Relief program. Keep in mind, this is for serious people only. If you're not looking to do one-on-one coaching, if you're not really in a place to take it very seriously or really invest in yourself to get out of the situation that you're in, save the position for someone else in need. Again, if you're interested, go to fitnessforbackpain.com/apply. Would love to have a conversation to see if what I do can actually help. Give these exercises a shot. Thanks for watching, guys. God bless, and I will see you on the next episode.